The College of Health Sciences at Jackson State University has a new Wellness on Wheels mobile lab. Now, the lab is a state-of-the-art unit designed to bring essential health services directly to Mississippi communities, especially those who suffer due to their zip code. Check it out. If you see this mobile unit rolling around the city and state, just know it's helping people who need it the most.
Breaking down barriers to healthcare.
The College of Health and Sciences at Jackson State University has launched the Wellness on Wheels mobile lab. The lab is a state-of-the-art unit designed to bring essential health services directly to Mississippi communities.
These services will include speech, language, public health screenings, as well as educational opportunities and resources for the state of Mississippi.
We can go into schools and provide information to high school students. We can go into churches and provide information in churches. We can go into other health centers.
And check out some of its features. The Wellness on Wheels mobile lab is funded by a grant partnership between Jackson State University and Mississippi College. This collaborative initiative received a $5 million grant to enhance public health programming here in the state.
If they don't have access to these types of services, then their symptoms will just go by the wayside.
We can do hearing screenings, hearing evaluations in here. This is our portable screening audiometer. Providing educational information, in providing earplugs to communities, or hearing protection to communities so that we can, when they go into these noisy environments, or just teaching healthy habits such as not listening to your music quite as loud as you have been.
This will all allow the mobile lab to travel to the most rural parts of Mississippi to help those who suffer the most due to their zip code and remove the barriers to healthcare access, prevention, education, and intervention.
Usually people in rural areas or counties don't have access to healthcare, whether it be educational access, financial access, as far as their location, they have to drive or have transportation needs that they cannot access what they need as far as healthcare.
And how will this close that gap?
So the mobile lab will make these services, the speech, language, hearing, public health screenings, more accessible to those residents, because we will be providing services where they live. So we can drive to these places to provide these screenings for the residents of Mississippi.
And what are the benefits of that?
So they will be able to know, whether it's hearing screening or speech and language screenings, they will be able to have or gauge their development as far as kids' development with speech and language needs or hearing needs. So they will be able to get hearing screenings, as well as, talk to them about their public health or their health needs, asking them questions that will, maybe give them a sense of where they are with their health.
And officials say this comprehensive setup will help JSU students in health sciences, especially those studying communicative disorders, public health, and healthcare administration. In fact, it will translate classroom knowledge into practical skills.
When we are able to serve individuals in our community, that it teaches our students who are going to become providers more about the clients that we serve.
So for instance, or for example, if we have a student that needs to screen a child's hearing, the child will walk up, we would ask the parent for consent to provide a hearing screening on their child. They will then be walked to the audiological booth. The student will perform the hearing screening. So they would explain to a child, raise your hand or drop a toy in the bucket so that we know that you heard this sound at this decibel or intensity of loudness with the noise. And then our supervisor will be standing either in the booth or outside of the booth supervising the students so that they are making sure that they are doing what they need to do for their hearing.
And why is it vital that these young people or these students get this hands-on training instead of just textbook training?
Because in our field, you will be working with real life patients. So we want to teach you while you are here under our thumb before you get out into the workforce.
JSU officials hope this will create a new chapter in providing accessible health care services and hands-on learning experiences for JSU students and the communities they serve.
I do think that when we can bring services to individuals, we're closing the gap.